On the island, only patients who live in the Victoria area, as I said, have the option of direct access to primary PCI. And that's why if you're living in this area, Central Island or North Island, and the best time to actually have your heart attack is when you're visiting in Victoria and having tea at the Empress Hotel, because that's when you're going to get the standard of care. That's when you're going to go directly to the cath lab. Otherwise, you're like everybody else. You're going to get the inferior treatment that I alluded to earlier that was developed in the 1970s. It's called thrombolytics, also known as a clotbuster. The chronic lack of cardiac service in Central Island and North Island has had a domino effect, really, with impaired healthcare delivery and huge budgetary implications. I would be asking some serious questions about why the health authority hasn't been successful in attracting cardiologists to Nanaimo and why we can't retain them. I would also wonder why there are only 2 cardiologists outside of Victoria, or 1 cardiologist per 300,000 potential patients. This is a shockingly low number and probably one of the worst in the country. We are just so underserviced. During a recent meeting with Island Health CEO Kathy McNeil and Leah Hollins, the chair of the board of directors, it was actually Deputy Minister Stephen Brown who raised the possibility of a modular cath lab at NRGH. All we are now really waiting for is the recommendation from our CEO, and funding can then be requested and we can make it happen. NRGH would then become the second hub with the surrounding communities that are previously mentioned as the spokes. I would like to close by saying that a 3-year plan, 3 years, to open up a cath lab at NRGH should be endorsed by the health authority as soon as possible. It's feasible, equitable, and ethical to offer this level of cardiac care to the 450,000 patients, potential patients. Let's make it happen and save lives.